how to treat acute manic episode. The acute manic episode is the most dangerous type of psychiatric patient. They're prone to be the most violent, most aggressive, intrusive. Agitation is one of the key symptoms. If they're hallucinating or they're so disorganized they're in imminent danger to themselves or someone else, or they just become impossible to manage, you have to put them in the hospital. So what I'm talking about now is for people who are outside the hospital. It's a whole nother issue when they're in the hospital. I'm going to talk about how you treat these patients outpatient. You know, I work for the mobile crisis team for the Health and Hospital Corporation of New York City, and I was called to the most bizarre circumstances when manic people were doing the most bizarre things on top of the Staten Island ferry with a huge, I don't know, I guess it was a sword or some metal pipe swinging at people, or someone was trying to throw their husband. It was a ballerina trying to throw someone out the window 3 stories up on the apartment. I came to one situation, someone was walking on a ledge dancing 10 stories up. I had someone who took a candelabra at St. Patrick's Cathedral in New York and was swinging it at patrons. Manic people are activated, energized, and dangerous. So in an outpatient setting, what are we dealing with? They talk a lot. They have lots of ideas. They're really aggressive. And they're I hate to use the words annoying, but God, are they annoying. They won't stop talking, and they're tangential. They go off on these tangents. They think they have superpowers. They're grandiose. They give away money. They spend money. They take drugs. They get very aggressive and loud. They really are disruptive to a home. They're very, very difficult on family members. They say, I don't love you. I don't want to be near you. You hate me. It's not true. You have to be patient with them. Although they're annoying, you have to realize this will change. They will come off the manic episode. They will be much better. They eat in messy ways. They make messes. They rip apart the house. The kitchen looks like a tornado came through it. They put clothes around. They're not taking care of their hygiene. They don't take the meds right at all. So unless the family can give them the meds, supervise what they're doing, you can't really let them out of the house, because there's no telling what they'll do. It's usually trouble, and it usually involves getting involved with the police, getting in fight. They use slurs and racial epitaphs and insults and anything you would think about not saying, they say. They threaten family members. You know, I would say 20% become dangerous and need to go to the hospital. 80% or more can be managed outside of the hospital. It's difficult. And to the family members treating them, you have my sympathies, because they will call you every insult. They're paranoid. They have an impaired sense of reality. They think loved ones are after them, and they think strangers are their friends. They do dangerous things in terms of agitating others, threatening other people, spending money, driving cars recklessly, moving in and out of traffic, walking in dangerous places. They have no sense of safety or what would be the right thing to do. How do you treat them? 1, keep them away from people. Keep them in a house with loved ones who, in spite of being provoked, won't do anything, because they will provoke anyone near them. So keep them away, and keep them away from cars. Keep them away from spending money, credit cards. And don't trust them with the safety of little children, animals. They can't be entrusted to take care of anything. They have to be watched and sort of cloistered in the house. You really have to give them meds. I'm not sure of any way to treat this. It's not like I'm like, there's a med for everything, but In this particular case, you got to give them meds. We'll start with antipsychotics. You have to bring them down quickly. The anti-manic drugs long-term, mood stabilizers like Lamictal, Triliptal, Depakote, lithium, take 10 days to work, so that's not going to work here. So forget about it. You may start those on them when they're calmed down, but they don't work now. So what you have to use now is a Resperdal works, 2 milligrams twice a day, maybe 2 milligrams 3 times a day, or Geodon 80 milligrams twice a day with food, or you're going to have to give them Seroquel. Sometimes I give up to, say, 300 milligrams 3 times a day, 600 milligrams twice a day, or give it all 900 milligrams or 1200 milligrams at bedtime. Whatever it takes. So it takes about 2 to 3 days. Get them to sleep. They must sleep. An older drug, Haldol, 5 milligrams or 10 milligrams twice a day, works. You must break the manic episode. You must make it so they want to sleep. The key feature of this manic episode is they haven't slept in days. And the less they sleep, it's like fuel to the mania. The less they sleep, the more manic they become. Be very careful here. You've got to get them to sleep. So if they sleep in the middle of the day, so be it. You have to medicate them to almost sedation. What else is therapeutic here are benzodiazepines, Ativan, Klonopin, Xanax. I use Klonopin outpatient, inpatient I use Ativan. Some of my colleagues use Xanax, I do not. I find it addicting. It works very well. For whatever my experience with dealing with people with addiction makes me not like that drug, and that's a whole nother video. So I either use Ativan or Klonopin. I like Klonopin, 2 milligrams 3 times a day, 2 milligrams 4 times a day. You can give a lot of this drug. It's very safe in overdose. It really, if you don't mix it with alcohol, it's very, very safe. Give it to them. I'm only talking about doing this for maybe 2 days, 3 days at the max. You should get them in a hospital. I break a manic episode within hours. 4 hours, 2 to 4 hours. If 2 milligrams doesn't work, give 4. If 4 milligrams doesn't work, give 6. If 6 doesn't work, give 8. Get them to slow down. And once you slow down, once they sleep, when they wake up, the episode is broken. Get aggressive the first day. So I'm sending this video and I'm making this for patients today. I've had 2 people in manic episodes. The police were called and they can't always take them away. If they're not a danger to themselves or others, they're manic, not stupid. They'll talk their way out of anything. Just remember that. You're dealing with highly intelligent people. It's just they're labile, not sleeping, can't concentrate, impulsive, bizarre, poor judgment, spend money, hypersexual, grandiose, inappropriate, agitated, easily angered, hedonistic, self-indulgent people. But they're good people, and you break the episode and they'll be apologetic. Things will settle down. But you break it. Don't let this go on. Not sleeping fuels mania. Mania fuels mania. The more time you spend manic, the more the manic episode. The manic episode would be extreme and require hospitalization when they become psychotic in terms of hallucinations, severe delusions, which they're getting command hallucinations to act on, or delusions that they act on. Most of them not that way. I hope this helps, and I'm sending it to, and this is for my patients who are dealing with family members who are manic. And also remember, once you break the manic episode, you know what comes next? Severe depression. So it's a complicated host of medicines you have to use to prevent a full-blown manic episode, a subsequent depressive episode, and to prevent the psychosis and to prevent violent and aggressive behaviors. Thank you. If this helps, please subscribe to my channel, dragresti.com. And I would appreciate some likes here. Thank you. Bye.